So we're now on to our next presentation, our keynote. So in 1954, the first Director General of the World Health Organization, Dr. Chisholm, a psychiatrist, shepherded the notion that mental health and physical health were intimately linked. As a call to action, he famously said, without mental health, there can be no true physical health. So here we are, 70 years later, and we haven't made the progress connecting these two areas that we owe our community, especially where women, vulnerable communities, and children are concerned. So today we have the honor of hearing from three leaders who are transforming behavioral health care every day. Nina will moderate our keynote presentation. We met through HITLAB when she was the lead coordinator for the Women's Health Tech Initiative as she was finishing her master's in public health. So Nina, I welcome you to the stage as a speaker, and we're really excited for you to introduce these three leaders.
Thank you so much, Susan. It's great to be here. Good afternoon. It's an amazing event, and having participated in many of these challenges over the years, I'm just so impressed by how many founders have mentioned the importance of the mind and body connection this year specifically, and I'm grateful that it's a key topic of conversation. It makes me all the more excited for this panel and to keep the discussion going. So as Susan mentioned, my name is Nina Roth. I am a director at Ellipsis Health. Ellipsis Health harnesses the unique power of voice as a vocal biomarker for earlier and better identification, assessment, and monitoring of anxiety and depression. At face value, we know that women's health is critical because women represent half the world's population. Yet the importance of adequate women's mental health care actually extends much further. Women's mental health is truly whole family health. Now to our panelists. These three leaders hail from different backgrounds, parts of the country, and areas of expertise. But what unites them all is that they are deeply committed to innovation in mental health. They are experts in their respective areas, and they are uber published in scientific journals, blogs, TED Talks, and more. Their messages are important, and we're so lucky to have them here today. So first up, Dr. Bradley Karlin serves as an executive medical director of behavioral health for Highmark Health, and is also an adjunct professor at the Bloomberg School of Public Health at Johns Hopkins University. He's a past president of the Society of Clinical Psychology and has previously served for over 7 years as National Mental Health Director for Psychotherapy and Psychogeriatrics for the U.S. Department of Veterans Affairs. Solome Tibebu is a passionate behavioral health strategist, investor, and consultant. She's the founder and host of Going Digital Behavioral Health Tech, the largest mental health and addiction technology and innovation community. She's also the founder of Cognific, a behavioral health consulting firm for healthcare and human service organizations, funds, and tech vendors. And we also have Dr. Carrion, who's a professor and vice chair of psychiatry and behavioral sciences at Stanford University and director of the Stanford Early Life Stress and Resilience Program. He is also faculty at Lucile Packard Children's Hospital and past chair of the Mental Health Oversight and Accountability Commission for the state of California. Wow. Thank you all so much for being here today. So let's kick things off with a table setting question. So turning to Dr. Karlin first, you have such extensive experience in behavioral health, working to support many diverse populations. In your opinion, what is the importance of the mind and body connection for health, not just for women, but for all?
Great, thanks, Nina, and good morning, everyone, and great to be with you, and great to be with my fellow panelists. The mind and body were once certainly thought to be distinct systems, and we now know that our overall health is the byproduct of a bidirectional interplay between our mind and our body. So how we think, feel, act have both a direct and indirect effect on our physical health, and the converse is true. Right? Our physical health affects our behavioral health. So for this reason, behavioral health is a critical part of overall health, undeniably, so much so that upwards of 70% of visits to primary care have a significant behavioral or psychological component. And this is not just behavioral health conditions like depression, anxiety, substance use disorder, but also health behaviors like think about sleep or lifestyle decisions, motivation, and adherence. So for this reason, I often refer to behavioral health as both a column, behavioral health conditions, and a row, health behaviors that cut across for all of us. think another relevant statistic I thought I would share to put this into context then is that individuals with behavioral health conditions have a 2 to 6 times greater annual healthcare expenditure than their non-behavioral health condition counterparts. And this is overwhelmingly due to increased healthcare costs for physical health conditions, not for the behavioral health conditions, which often are significantly underutilized. The other side of the coin, though, is that the focus of most of my days then is that the unprecedented technological and clinical innovation currently reshaping the field, given all of what I've just articulated, presents an unprecedented opportunity to improve overall health. So excited about what the future may hold, but certainly we have a lot of work to do as we think about how the mind and body come together.
Thank you, Dr. Karlin. I think that's the perfect way to frame the conversation moving forward. So now on to Solome. I'm always so inspired by your story, and I'm wondering if you could elaborate on how you've arrived to where you are today as a leader in this space, and tell us a little bit about why you were originally drawn to this work.
Thanks so much, Nina, and for everyone for being here. What an exciting event. So yeah, I came into this space not as a clinician or a technologist, but as an anxious teenager. I had really bad anxiety and OCD as a teen. And at the time, it took 4 different therapists and 4 different psychiatrists to finally find the right solution for me to be able to manage the OCD. And thank goodness I was in a situation where I was even able to access those resources, because so many do not. But looking back, it took that many different interactions with the systems for even my parents to know the phrase obsessive compulsive disorder in either of their languages. And so you can imagine I struggled and navigated as a struggling teen. And I recall I was the type of young person who wanted to go to Barnes and Nobles on a Friday night and read books about what is OCD. And I just recall that, as cliche as it sounds, knowledge really is power. And I remember thinking to myself, wow, why can't all teens everywhere get access to this kind of psychoeducation? It really did help me so much. And so in 2006, when I was 16, I started anxietyandteens.com, very creatively named, first 14 by teen online resource to support young people in their mental health, and continued that nonprofit for 10 years, which eventually led me into a career focused on expanding access to mental health and substance use services through tech and innovation.
Thanks for sharing, Solome. I love how you're attacking the most pertinent problems we're facing through a lens of lived experience. So thank you for sharing. And now turning to Dr. Carrion. Given your extensive background and your work with diverse populations around California and beyond while responding to crisis events, can you speak to the impact of trauma? And building on that, could you explain some of the work that you do at Stanford that addresses resilience?
Sure, Nina. Hi, everyone. Great to be here with you today. We are all stressed human beings. We all experience stress, and we are able to manage stress. In fact, the more stress that we have, the better we perform and the better our health. That's how vaccines work, right? They're a stressor to our immune system and makes that the immune system works better. But that operates in an inverted U-shaped curve. It's only good up to an optimal point. After that optimal point, what we see is that our performance, our health declines. And that's where trauma resides. When really stress has become so much, that is what we call allostatic load. It's not about the last traumatic event that you experience. It's not about the natural disaster or the episode of violence, but it's about all the physiological accumulation of stressors that we've had throughout our life. And we call that the allostatic load. In my team, we think about it as a backpack. We can all carry a backpack, but if you're 5, 6, 7 years old and your backpack is really heavy, you may fall backwards, right? You need some resources, some help, some guidance. So that balance between the stressors and the resources is what makes each of us have different manifestations to the experience of trauma. In the side of the resources, we have our own coping styles, our family support, our opportunities, and we really want to maximize that side of the balance, that side of the resources. So what we do at Stanford in my program, the Early Life Stress and Resilience program, is that we try to strengthen the resources and the capabilities that individuals have to be able to manage traumatic stressors. And in doing so, building not only resilience, but something that's even better, which is called adaptation. Resilience is a physics term, right? It means the coil bounces back to where it was before. After COVID, for example, we don't want to go back to where we were before. We want to be at a better place. We want to adapt to the changes that we've had to experience and learn. And the same with every type of trauma, either type 1 trauma, an acute event, or type 2, the chronic accumulated event. Trauma has this issue that it can really impact our milestones. So we really want to minimize that. In terms of how we build that resilience, we have a treatment modality that we've developed called Q-center therapy. And Q-center therapy pays attention to the triggers that currently remind you of past events in a conscious or unconscious way. And it actually triggers a response that was adaptive at one point, but now may be maladaptive. For example, running at some point when you were experiencing violence to get out of a situation might be very adaptive. But if the sound in the classroom reminds you of that traumatic event and you leave the classroom running, then your response now becomes maladaptive. So developing new responses is something that Q-center therapy helps with at the same time that you get exposure to certain cues. And it's not only in the what, in terms of components of interventions that we do, but it's also in the how. It's also how we empower children and young adults and help them become self-efficacious in terms of how they can become their own agents of change. So all of this has to do with treatment. Something that is very important is prevention. How do we help individuals develop and fortify their toolboxes even before trauma happens? And in there, we have a host number of things. We have a lot of self-care with good nutrition and good sleep, but we also have things like mindfulness and yoga. For example, we've done studies that demonstrate that our deep sleep improves once we engage on mindfulness exercises, for example, and so does our brain function.
Thanks, Dr. Carrion. Thanks so much for digging in. It's fascinating to hear you talk about stress and trauma and resilience. And so I'd like to go back to Dr. Karlin and dig in here a little bit. You have extensive experience working at organizations like Highmark Health, the VA, and as a professor within the public health space at Johns Hopkins. I'd love to hear from your perspective, what are the most significant challenges within behavioral health right now?
Yeah, so, this, of course, I think, as we all know, is an unprecedented time of need for behavioral health, though at the same time, the behavioral health crisis predated the pandemic. COVID-19 just added fuel to an existing fire. So currently, we have a situation where rates of behavioral health need are at an all-time high, yet only 40% of those in need of care get any type of treatment. And even more sobering is that only 15% of individuals with serious behavioral health needs receive what's considered minimally acceptable treatment according to clinical practice guidelines. You'd be fairly hard-pressed to find similar statistics in other areas of healthcare. For those that do get care, there's a significant lag time to treatment of 8 to 10, in some studies even more years, from the initial onset of symptoms to when individuals actually engage in care. And that's just for the 40% that do engage in care. So I'll mention a few factors contributing to how we got here. So first, behavioral health care has long been very reactive and downstream focused. And that's why we see an 8 to 10 or more year time lag from the initial onset of symptoms to engagement in care. Typically, individuals will have tried many other things before they ultimately reach out for care, and then reach out for care sometimes as a last resort when other attempts to try to get help or ease symptoms have not been successful. Second is behavioral health treatment is highly variable in quality. So I often say that not all psychotherapy, for example, is created equal. So in the case of trauma, as we just heard a little bit about, for instance, we have gold standard treatments for PTSD, for example, that include active change ingredients for overcoming trauma that unfortunately comprise less than 10% of PTSD treatment visits in this nation and abroad. In fact, while I was in VA, my team worked to implement the world's largest implementation of 2 grade A recommended treatments for PTSD for veterans, especially this was when the nation was at the height of war and we had folks returning from Iraq and Afghanistan, but also a large number of older veterans suffering from chronic PTSD. Once implemented, we found led to much greater improvements in the lives of veterans. And third is behavioral health care is highly fragmented. I think we all certainly have known this, but it's also contributed to stigma, the fragmentation, and engagement challenges, which themselves are also key barriers. And then I'll also note that we don't do a very good job of personalizing and certainly not of right-sizing behavioral health treatments. And I think Solome talked a little bit about her specific experience. I think that is certainly very consistent with that. But we don't do a good job of personalizing and right-sizing treatments to individuals' needs and preferences. It's really more of a one-size-fits-most approach.
Thank you for that. And building upon that and thinking of those challenges that you've just brought up, looking into the future, how do we address these challenges with technology?
Yeah, that's the direction I like to look in. I tend to be an optimist by nature, and I think while the need is unprecedented, so too is the opportunity. We've never had an opportunity like this within our industry, and that's an opportunity to leverage technological and clinical innovations that we've seen over the last couple of years. In fact, health economists have estimated that in the last couple of years, the field of behavioral health care has innovated the equivalent of 20 to 30 years prior to the pandemic. So I like to believe that this is a defining moment for the field and for how technology can reshape the industry. And so I'll mention 3 specific areas of opportunity for technology that I see. So first, certainly, is tele or virtual behavioral health. We certainly have seen a proliferation of that within Highmark. So Highmark Health is both a payer and a provider system. So we operate a number of hospitals and healthcare facilities, but also function as a payer, operating one of the nation's largest Blue Cross Blue Shield plans. And we witnessed approximately 7,000% increase, 7,000% increase in telebehavioral healthcare delivery in 2020. And then that sustained in 2021 as pandemic pressures eased. And I note this because it's not, I think, only an opportunity and a function of greater physical access to care that telebehavioral health provides, but also greater psychological access to care. What I mean by that is receiving behavioral health care through one's computer screen or cell phone has helped to destigmatize and normalize behavioral health treatment. I think it's very interesting. Even as a provider myself, there's something that really being able to connect with someone over a computer screen has really allowed for opportunities for increasing access in many domains. Second is that in addition to telebehavioral health care, digital behavioral health applications present particular opportunities for moving to the left. Not speaking politically necessarily, but on the care continuum to serve as what we sometimes call lower intensity interventions for milder needs at scale. And the field has been in search for lower intensity interventions for some time. And that provides also an opportunity to free up more specialized capacity and allow for greater upstream focus and more personalized care. Not everyone necessarily needs months or years of therapy or medication, especially if we meet their needs earlier in their clinical trajectory. And I'll note there are now about 20,000 behavioral health applications in market. A lot of that is noise. There are a few signals that I think present considerable opportunity. We'll see a lot of maturation and consolidation in the coming years of what is now a sector in, I would say, gangly adolescence. And then the last opportunity I'll mention is one for moving even more upstream through the use of data and AI to proactively identify need much sooner and to reach out proactively rather than wait for patients to reach in. So one application of this that is particularly innovative is digital phenotyping. So this involves using passive data acquisition through cell phones or wearables to detect changes in behavior. So these changes could be changes in rate or rhythm of speech, sedentary versus active behavior, changes in social communication, changes in sleep that can signal or even predict a behavioral health problem before PCP or even a patient may be aware of it. So I like to think that this is not science fiction, but an emerging reality. So really excited about, I think, what the future may hold for an industry that's long been ripe for innovation.
Great perspective, a lot to look forward to, and a perspective that we definitely appreciate and echo at Ellipsis Health as we're striving to identify patients sooner and curb unnecessary suffering. So thanks for that perspective. Now, moving to Dr. Carrion, what special role do women have on recovery and technology?
Well, I would think that technology has a lot to gain by including women in their work. Women bring their creativity, their good listening skills, their ability to collaborate. There's a study that was published in the New England Journal of Medicine about 10 years ago, where they were looking at the IQ of groups. So rather than the IQ of an individual, they wanted to know how a group would work in terms of their productivity, in terms of their performance, reaching their goals, and all of that. And they really found that the one factor that was more significant in terms of how to increase the IQ of a group was the number of females that were in that group. So by having the females there in those groups, the groups became more productive, more collaborative. They were listening to each other and reached this high level of productivity. So technology has a lot to gain. I would say technology has more to gain from women participating in technology that women have to gain from being in technology. So, so there is a lot that our colleague females are offering to this new access venue that we should welcome.
And thank you, Solome. There are a lot of people in this audience who are founders, investors, and even folks looking to invest for the first time in women's health. So as a thought leader and an investor in behavioral health solutions, how do you think about investment in women's health?
Mm-hmm. Well, first I have to commend Dr. Karlin for trying to condense all of the many ways technologies could address the space. As soon as I heard Nina ask the question, I'm like, I mean, it's just incredible what has happened over these last few years. Thanks in part to reduce stigma that consumers are talking more and raising their hands to say, I need the help. So now to address your question, while my focus has been behavioral health, like many in the audience, I've been really astounded to see and just learn more about the state of maternal mental health in this country, women's health care, particularly for Black women. It's abysmal. So I'm excited to hear about how many innovations are being developed. I'm particularly excited to see even how many maternal mental health entrepreneurs I can see in the audience here, which is such a critical opportunity for us right now more than ever. So please keep up the good work, everyone. For me, and many of you who you've seen me before speak about this topic, I do say that I have a bias towards people who have lived experience when it comes to my investing. And not only has just been my own path, but this path of being an entrepreneur is a challenging one. and what is going to draw you back to the mission when things get really challenging. I found that folks who have that connection to lived experience, it's important and effective in that way. But you also have to know your stuff too. It's got to be both. And so that would be my piece of advice for those entrepreneurs who are pitching in the audience, being able to weave both of those aspects in your presentations. These last couple of years, you've probably seen this, the funding, at least in behavioral health and the industry as a whole. 2021, just the numbers were out of the roof. Now we're kind of normalizing a bit more, which I think is good because, as both of my panelists have mentioned, not everything needed to get funded the last couple of years. There's so many solutions, but we're still asking questions of, is this mental health care even evidence-based? And I think a lot of technologies are missing that aspect. And so in some ways, the limited funding situation compared to a year or two ago will be focused on funding the best, most effective solutions, I would hope. And so, yeah, I'm still optimistic, but those are my pieces of advice for entrepreneurs.
Thank you so much. I believe we're at time. I appreciate the three of you being here as experts and sharing your unique insights and perspectives. And I just have to say that I always cherish these events and leave feeling so inspired and so educated and so connected. And I hope that the audience is feeling the same. So back to you, Susan.
Thank you. Thank you so much for being here. This topic is one that's very personal to me, so I really appreciate you taking the time to come.